welcome to Health Talk. I'm your host, Jill Fraley-Dotson. Of course, Health Talk, a service of Pikeville Medical Center. Today, we are talking with Dr. Josephine Oweah, who is Associate Professor, Director of Personal and Professional Development, and an optometrist with the Kentucky College of Optometry right here in Pikeville. Dr. Oweah, welcome to Health Talk.
Thank you for having me.
Such a pleasure to have you. First of all, I want you to know how happy we are to have you here in the Pikeville community, and certainly to have the Kentucky College of Optometry now located in our community in its association with the hospital and with Pikeville, the University of Pikeville. This is the school's second year, so let's kind of bring everybody up to date and let everyone know how it's going.
Yes, so things are going really well. We're actually doing the orientation right now for our second year. So class of 2020, they're moving into their second year, and now we have the class of 2021 that started, and I ran over from orientation here today.
Yeah.
Yes, so it's going well.
A very busy time for you too, accepting
sure
all
is.
those new students, getting them acclimated to the way things are going to be the next few years.
Yes,
Tell us about your background a little bit and how you got into this profession.
So I did a pediatric residency right after optometry school. I went to optometry school in Philadelphia. Right after that, I did a pediatric residency. And then I went on to work at Johns Hopkins Hospital in Maryland, Baltimore, Maryland. I was there for 12 years, and then I came here right after that.
Did you have a mentor or someone who really influenced you to get you into this field?
So I didn't have a mentor per se. I knew that I wanted to do optometry. I didn't have a mentor per se. However, my parents were big cheerleaders. They wanted me to go ahead and accomplish the goal that I wanted to accomplish.
Certainly. The optometry clinic is a partnership between Pikeville Medical Center at the Kentucky College of Optometry. Tell us a little bit about the partnership and how that works.
So how it works, since August of 2016, our faculty from the Kentucky College of Optometry have actually been rotating through Pikeville Medical Center in their eye care unit, and it's amazing. I know, for instance, I'm there on Wednesday morning seeing kids, and my other colleagues also are there.
It's time to go back to school for our little ones. They're getting ready, some for the first time, our kindergartners, and then others that have been there before. We know that good vision is essential for learning, so let's talk a little bit about some effects that poor vision can have on children when they're in the classroom.
Yeah, so some of the studies that I've actually been a part of, that I've seen firsthand, have shown that poor vision could lead to poor reading proficiency in children, especially children in second and third grade, which is the time when they're learning to read. Unfortunately, by the time they get to fifth and sixth grade, they're reading to learn, but their vision was already affected when they were in second grade. The other thing is, some parents may think that their children have developmental delays or developmental difficulties. It's also associated with poor vision.
At what age should our children start to have their first eye exam?
So according to the American Optometric Association, 6 months. But that being said, we have to make sure that if you notice something's wrong with your child a little bit early, you bring them in as early as you need to. 4 weeks old, you need to bring them in if you think something is wrong.
How often, after that first initial exam, should children have their eyes examined?
So the next one after 6 months, if the child is healthy and nothing's going on, should be about 2.5 years to about 3 years. And then when they start school, of course, and then after that, every year.
As a parent, what do we look for as warning signs that our children's vision might be affected?
Okay, some of the things that you can look at would be the children rubbing their eyes, red eyes, teary eyes, children literally having eye turns where their eyes are turning in or out. That could be indicative of something going on with the vision.
Does the vision change as they grow?
So vision does change. So nearsightedness becomes more nearsighted. And a child that's farsighted could actually lose a little bit of that farsightedness.
Okay, so let's talk about the eye exam itself. I'm the mother of a 2.5-year-old, and she has not had her first eye exam, which now I know that she probably needs to get there. We've had our first dental visit, so the eye exam should follow.
Yes, ma'am.
But what can, especially children who are so small, they become a little scared and a little terrified, and obviously you know how to deal with those sorts of behaviors, but what actually happens during the exam for the small children?
Wonderful. So when the child comes in, I get them acclimated with my room. I have a lot of toys in my pocket that I have to bring out. I try to assess how well their visual health is, and I also try to see what their visual acuity is as much as I can, and that means how well they're seeing, how sharp they're seeing. Those are the things I'll pay attention to, and I also have to dilate them and look at the back of the eyes to make sure the health is also good there too.
Okay, so let's talk about the dilation. As an adult, I have to have my eyes dilated, and it's not always a comfortable experience. So we all know that.
Yes, ma'am.
So how do children adapt to that sort, or that actual activity during the exam?
Okay, so at that point we put the drops in. I would already educate you, the parent, and tell you that your kid's going to be fuzzy. They may want to go to sleep when they get home. They may sleep on the way home from the hospital. Other things is some kids don't pay much attention to it, and some kids get really finicky. They'll rub their eyes, but I'll warn you about that. And it lasts for about 2 hours.
So the vision will be blurry.
Yes.
For a little bit after the exam.
Yes, ma'am.
Something we should certainly look out for.
Yes, ma'am.
If you were to find over the course of your examination that the child does in fact have some poor vision, are glasses the only option, and how early do we start that procedure?
Yes, ma'am. So in my very young children, glasses will be my first go-to. And some kids, we do contacts. And some kids, I can do something like vision therapy, where it's like vision training for the eyes, in older kids though.
What about, you mentioned contacts.
Yes, ma'am.
How early do we start contacts, or what is the good age for that? Because I know as an adult, when the doctor mentioned to me that I might consider contacts, it was a little bit scary because there's the whole process of putting them in effectively and making sure they're not turned inside out. But as a child, I think that would be a little bit of a challenge.
Okay. So this is, even at my house, this is a big issue for us now. So I've fit kids as young as 7 or 8 in contacts. However, I have to defer to the parent and ask the parent. So I would ask you, do you think your child is mature enough to handle it? So with that being said, I would say, how often does she or he lose his glasses? Are they good on their glasses? Do they clean their nails? Do they wash their hands? Do they have good hygiene? If you say yes, then that means that kid's mature enough.
Okay.
Yes.
So not something that parents should be nervous about.
No.
But certainly they would have to take a great amount of responsibility too with their children, and they need to be mature enough to handle.
Yes, ma'am.
Let's talk about smart devices, computers, TVs, cell phones, iPads, any kind of tablet. It's not uncommon. In fact, it's very common nowadays to see children at a restaurant, at church, at home, obviously, glued to something, be it the computer, be it an iPad. And a lot of times they can be used as a great learning device, and of course we use them in our schools too, but how do those sorts of activities affect children's eyesight? And I'm sure it starts at a very early age.
Yes. So it's not going to necessarily make their the sharpness of their vision worse, but it could make the eye health. It could have effects on the eye health. It could make the eyes feel uncomfortable. If they're holding their smart device too close or for too long, the eyes will start to dry out. When the eyes dry out, the eyes get red. When the eyes get red, then they start to itch and start to rub, and it just becomes very uncomfortable.
Yeah.
Yes.
Let's talk a little bit before we go any further about, you mentioned with the contacts about the cleanliness of nails and hands. Hygiene has to play a big part when we're dealing with children, specifically with their eyes.
Yes.
Any pointers for parents as to how to get their children to really make sure? We always want them to wash their hands, but any pointers that you have as far as their eye care goes?
So one thing that parents could do, if the parent is a contact lens wearer themselves, you can have your child model your behavior and say, well, okay, look at the way I do it. I wash my hands before I put it in. I have to make sure the contacts are clean. Look at the way I do it. In addition to that, you have to also make sure that you're present at the fitting so that you can see how the technician is training your child to put the contacts in and out, because it is the responsibility of the child now, so we're giving them a big responsibility, and you need to be able to guide them through that.
Certainly so. Let's talk about health and nutrition for just a moment. Now, I've always heard that if you eat a lot of carrots, this is an old lifestyle, that's really good for your eyes and your vision. Does nutrition play a big part in our eyesight?
You know what? So recent research, probably over the past couple of years, has been showing that nutrition does have something to do with vision. And in terms of carrots, carrots has beta carotene in it, and we need that for the development of the eyes and also the maturation of the eyesight. So that's why carrots gets the rap sometimes, but nutrition does have something to do with vision.
Certainly so. One other thing I do want to ask you about too, as far as health of our children go, children who are diagnosed with, say, childhood diabetes.
Yes, ma'am.
That diabetes, we all know, affects eyesight in a huge way. How do you address that issue?
So as soon as the parent comes in, that's part of the exam. I will ask the questions, does your child have any type of medical problems? When the parent discloses to me that the child does, I will make sure that I do the dilated eye examination, do the visual acuity to make sure that I can pick up any retinal changes or diabetes changes at the back of the eyes.
Okay. Just something that popped in my mind as we were talking about it. Of course, diabetes certainly affects so many people in our community, and children are not immune to that. Wanted to ask you about some terms that we commonly hear our optometrists use, and the terms can sometimes be a little bit confusing, even for adults. So I want to ask you to explain a few different terms to us. So tell us what nearsightedness is.
So nearsightedness means that a person or a child, they're able to see up close but having difficulty seeing at distance. That's nearsightedness.
Okay, very simple.
Yes.
Farsightedness.
So farsightedness means, now farsightedness is a little more complicated. It means that a child, I'll use a child as an example, they have to focus all the time to see. So when they're looking at their smart device, they have to focus to see it. When they now have to look across the room and look at the clock, they have to refocus. So it's that focusing back and forth that causes the problem. And the brain's going to say, well, I'm just going to be able to see at distance, and right now I can't see it near.
Right.
Yes.
Okay. Those are very confusing terms. Thank you for explaining. Let's explain the numbers used in measuring eyesight. For example, 20/20 vision.
Yes, ma'am. So visual acuity, that number is actually called the visual acuity, and that's the parameter that we use to measure the sharpness of the vision. So a person who's 20/20, it means what they see at 20 feet is what someone with very sharp vision also sees at 20 feet, as opposed to 20/300. What that person sees at 20 feet is what somebody with sharper vision sees at 300 feet. So that distance between there tells you that the person who's standing closer to the target is not seeing as well.
At what point does someone need glasses?
So I'll take an example for kids. So if a child is a school-age child and they're not seeing better than 20/30, I would have to start to initiate correction at that point.
Okay. So now that we have all of our information, we know what nearsightedness is, farsightedness, 20/20 when you need glasses, and certainly how to train our children up to be good visual patients.
Yes.
How do we make an appointment?
So in order to make an appointment, you want to call 218-2209. They'll be able to get you in with any of my colleagues or myself. Yes.
So you call that number. One more thing I want to ask you before we close out today. Anything we can do to prevent our eyesight from getting worse?
So there's not really anything you can do from getting the sharpness of the vision getting worse, but you can do things to protect the eye health. Things that you can do, like wearing sunglasses, make sure you have UV protection on them, make sure you wear baseball hats and baseball caps, and make sure that you wear protective eyewear when you're doing the grass, when you're mowing the lawn, things like that.
Absolutely. Even our children, when they're out, they all want to get in. If we're planting flowers or if you're helping cut grass, they still need to have some type of protective eyewear on, just like we would. We know how to get an appointment, 218-2209. Tell everyone where you're located at the hospital.
I am located on the 9th floor. I actually see patients on Wednesdays. So I'm located on the 9th floor. Make sure you park on the 9th floor of the garage and walk straight through, and you'll be able to come into our clinic.
Hours of the clinic?
My colleagues and I are there Mondays and Thursdays from 8 to 5, and I'm there Wednesdays from 8 to noon.
If you have a child that is going to be in kindergarten this year, or if you have one that's younger and has not had their eye exam, make sure that you contact the hospital, get an appointment just to make sure that their eye health is where it should be.
Yes.
We can never be too careful with our vision.
No, we can't.
Dr. Josephine Oya, thank you so much for being a part of Health Talk today. Great information. I know as a parent, I am excited to know that now I can take her to get her vision screened to make sure that she has great eye health as she grows into an older child and even as into an adult.
Yes, ma'am.
This has been Health Talk, a service of Pikeville Medical Center, proud member of the Mayo Clinic Care Network.